What are the implications of rare cervical cancer types? Some cervical cancers are quite rare and can be tricky to diagnose and treat. These uncommon types include adenosquamous carcinoma, small cell neuroendocrine carcinoma, gastric-type adenocarcinoma, clear cell carcinoma, lymphomas, and sarcomas. Each of these has unique features that impact how doctors approach their care. Because they behave differently from the more common squamous cell and usual adenocarcinomas, understanding these differences is key to improving patient outcomes. Many rare cervical cancers tend to be more aggressive. For example, small cell neuroendocrine carcinoma is known for rapid growth and early spread to other parts of the body. This often results in a poorer outlook compared to typical cervical cancers. Gastric-type adenocarcinoma and clear cell carcinoma also tend to have worse survival rates and are more likely to recur after treatment. These cancers often grow quickly and are more likely to metastasize, making early detection and aggressive management essential. While most cervical cancers are linked to human papillomavirus infection, some rare types are HPV-independent. For instance, gastric-type and clear cell adenocarcinomas usually do not have HPV involvement. Conversely, small cell neuroendocrine carcinoma is often associated with HPV, especially HPV subtype 18. This distinction influences screening strategies because HPV testing and cytology are effective for HPV-related cancers but less so for HPV-independent types. Recognizing these differences helps doctors decide on the best diagnostic and preventive measures. Diagnosing these rare cancers can be challenging. They often look similar to other tumors or benign lesions under the microscope. Special tests like immunohistochemical staining and molecular profiling are needed to identify their specific features. For example, markers such as P16, P53, and CK7 help distinguish these cancers from more common types. Accurate diagnosis is crucial because treatment options and prognosis vary significantly depending on the cancer subtype. Treatment approaches for rare cervical cancers often differ from those used for more common types. For aggressive cancers like small cell neuroendocrine carcinoma, a combination of surgery, chemotherapy, and radiation is usually recommended. Because of their high risk of spreading, these cancers often requiring more intensive systemic therapy. Other rare types, like lymphomas or sarcomas, may need entirely different treatment plans tailored to their specific biology. Because these cancers are less common, treatment often involves a multidisciplinary team and close follow-up to monitor for recurrence. Some rare cervical cancers also have specific genetic mutations or alterations in signaling pathways. For example, mutations in PIK3CA, KRAS, or PTN genes can influence how the cancer behaves and may someday guide targeted therapies. However, research into these options is ongoing, and current standard treatments are mainly based on the cancer's histology and stage. Understanding these molecular features can help develop future personalized treatments. Screening and early detection of rare cervical cancers pose additional challenges. Since some are HPV-independent, they may not be caught by standard HPV testing or Pap smears. This can lead to delays in diagnosis, which worsens the prognosis. Healthcare providers need to be aware of these rare types and consider further testing when abnormalities are found, even if HPV tests are negative. Prompt biopsy and detailed analysis are essential for accurate diagnosis. In summary, rare cervical cancer types have significant implications for how they are diagnosed, treated, and understood. They tend to be more aggressive and may require different treatment strategies. Because they can be harder to detect early, awareness among clinicians is vital. Patients diagnosed with these rare cancers should consult specialists experienced in managing unusual cervical tumors. Ongoing research aims to improve targeted therapies and screening methods, helping to give patients the best possible care. Always remember to seek personalized advice from healthcare professionals for any concerns about cervical health.